This is a Fox News Alert. Hello, everyone, and welcome to The Five. I'm Kimberly Guilfoyle. We just heard moments ago from Speaker Paul Ryan and other House Republicans at a press conference on the American Health Care Act, the GOP's replacement plan for Obamacare. Ryan says Republicans will have enough votes to pass the plan in the House. Earlier, we heard from the president on the measure.
And I'm proud to support the replacement plan released by the House of Representatives and encouraged by members of both parties. I think really that we're going to have something that's going to be much more understood and much more popular than people can even imagine. I think it's going to go very quickly. I hope it's going to go very quickly.
His Health and Human Services Secretary Tom Price also made the case for this new bill.
That is that we need a system that's affordable for folks, a system that's accessible for individuals, that's of the highest quality, that incentivizes innovation, and that empowers patients. And so our goal is absolutely to make certain that individuals have the opportunity to select their physician. In terms of premiums, we believe strongly that through this whole process and as it takes effect, that we'll see a decrease in not only the premiums that individuals will see, but a decrease in the cost of health care for folks. The American people have said to their elected leaders that the Obamacare process for them gaining coverage and care is not working. So we believe it's important to respond to the American people and provide a health care system that allows for them to purchase the kind of coverage and care that they desire.
Okay, so a big day for the House GOP Republicans, a promise that was made, a promise that was kept. Eric, what do you make of them? Well, this is Bob Beckel, or some bizarre individual that is occupying the body.
Go ahead, Eric.
Okay, sponsored by Insanity. Dana Perino, you're familiar with her. Eric Bowling, Greg Gutfeld. Okay, everyone good?
Thank you, KG, yeah.
You're welcome. Okay, Bowling, kindly proceed. So what do you make of this in terms of the merits, the structure, and also the rollout?
I don't see a lot of merits in it. I just feel, someone said, is this Obamacare light? No, it's Obamacare 2.0. So all day I've heard Sean Spicer, I've heard Dr. Price, I've heard Paul Ryan tell us that there is no mandate anymore, but the plan actually does continue to have a mandate. The individual mandate is still there, only it's worse because now if you let your insurance lapse, you get a 30% pay. You have to pay 30% not to the government anymore. Now you pay it to the insurance companies. Cadillac tax. They don't touch Cadillac tax. We fought against Cadillac taxes on this show for years. It's still there. That's not touched till 2025. Subsidies, they still go. There's more subsidies in this bill than Obamacare. Medicaid expansion. They don't touch Medicaid expansion for another 5 years. I mean, these are all the things we fought against. But the one that I really, really care about the most, the one that would make a free market solution, drive the cost curve down on health care and insurance, would be being able to buy it across state lines. It's not in this bill as of yet. I don't know why you put something out there that you say you're going to fix 2 more times over the next few months. Just fix the damn thing. You've had 6 years to come up with a replacement. Fix it. Put the across state lines in there. Put the tort reform in there and take out the mandates. You can do this, Republicans. There's no reason to do this, to vote on this bill now.
Brothers and sisters, hallelujah. Hallelujah.
It's a bad bill.
Hallelujah. Let's hear it for Eric Bowen. Come on.
Take it easy on the chair.
Why are we applauding?
It's not paid
no,
for
it's
yet.
really good. I think
He's kind of agreeing with him.
No, it is not a whole lot different. It puts more poor people out in the streets. Is what it does. But outside of that, I mean, Ryan, they say repeal or replace all they want. They're trying to get that sunk into people's heads. It's not repeal. It's not replace. It is BS, and that's what it was meant to be, and it's not going to be law, so you don't have to worry about it.
God, you clapped so loud and you popped it out.
I was very proud of Eric.
Okay, perfect. All right, Dana, so do you share Eric's concerns or sentiments?
Well,
Did they go far enough?
Not necessarily, because I feel like I've got a lot of reading to do, even though it is much smaller bill than the other one. But a lot of things that came out today are very interesting to me. Of course, we knew the Democrats were going to trash it, but conservatives are not going to defend it either. But here's the thing. President Trump says this is his bill. He says this is our plan. And for those concerned about the state lines issue, and I agree that that might be a concern, he said, well, there will be stage 2 or 3, so don't worry because that's coming. So I think that if this is going to pass, it is going to need the full weight of President Trump pushing for it. You saw what it took for President Obama. I think he gave 58 speeches about it. He lost his majority basically because of it, but he thought it was worth doing. And the race to define the benefits of this bill will be taking place over the next 36 hours. I do think that Secretary Tom Price arguably had the best presentation today and was able to answer questions in the most fulsome yet succinct way and with some confidence. They've got a lot of work to do. And here's the other thing. Today, Obamacare is at its most popular ever, at 4.5% above where it was before in the Real Clear Politics average. So if they want to get this done, they're going to need the president's help. And the president said he wants it done quickly, and he can make that happen if he chooses to.
Okay. All right. So, Greg, did you think this went far enough, or why perhaps did they throttle back a bit?
I think it was a good start. I have 4 positives. I think I have 4 positives here. Number 1, it's called the American Health Care Act, not the Kenyan Health Care Act.
Good point.
Thank you very much. So what does
I don't believe you just said that.
Delayed laugh track
I know.
over here.
What does a chasing dog do when it finally catches the car? This is what you're seeing. So a car finally gets it. It's the Obama car. The Republicans finally get it, and so they have to figure out how to do it. I don't think they were quite prepared. But the good news is, this is a good worry to have. It means you won the election. Not being able to fight amongst yourselves about the repealing and replacement of Obamacare. Well, if you didn't have that fight, that means you lost. So this is actually a good problem to have. This conflict happens when you win elections. Third, I do like that it's smaller than the previous. You went from Mama June, from Here Comes Honey Boo Boo, to Dana Perino. You just took this giant thing and you made it smaller, and I think that empowers people. It's easier to read. Also, I talked to Dr. Mark Siegel, and the one positive thing that I didn't know before, how the tax credits work, which I think is positive. Who was really pissed off about this? The people that felt coerced by the mandate. The tax credits are now the lollipop. You take this money of the tax credits, you enter the marketplace, and you buy a more cost-effective plan, which is the catastrophic health insurance. So, I don't have to pay for your mammograms, and you don't have to pay for my prostate exam.
Hey, did you get your drug dealer late last night or what?
Why? I did my research, Bob.
I did mine too.
The tax credits don't make sense, right, Eric?
But it's the same. It's a pig by another name. It's
right.
a pig with lipstick, because all you're saying is if you want that tax credit, you have to buy insurance. But if you don't buy insurance, you're going to get this 30% increase in your tax.
Isn't that at the discretion of the health insurance company, though?
No, listen to me. Here, they're getting the 30%. It's not even the government taking it anymore. It's not paying for Obamacare.
But conceivably, the health insurance company could decide from a competitive perspective not to.
Money that's been
if they want to win your business,
they want
to
increase their numbers.
If they really wanted to do all this, drop the state line issue and make it competitive.
But the president said that's coming.
I know, but they didn't say that at the beginning. All of a sudden, later in the day, it became phase 2 and phase 3 was going to happen. Here's at the end of the day, Greg, you know you hate this, but what does it really do to your insurance premiums? This bill, as we see it right now, does absolutely nothing to it. They don't go down at all. In fact, they may even go up. I've said this before.
So the dog chases the car and sadly gets hit by it.
I have a niece outside of Chicago who has 5 kids who can barely pay for her health insurance. She hates Obamacare. It's awful. This does nothing to her premium. Not a darn thing.
Bob, real quick, and I got to hit
Okay, what I was just going to say is that, on a very serious note, the Democrats would have gone along with the state lines thing. That's one thing that they would have agreed to.
Really?
And I'm amazed they didn't put it in. It's a no-brainer.
Well, maybe they will in order as a sweetener later.
Yeah, maybe it could be, but
what are they waiting for? It was one of the biggest talking points for the last 6 years.
This was the opportunity to put it through because they had the momentum and the goodwill. Well, as we mentioned, not all Republicans are happy with the legislation either, particularly Senator Rand Paul.
The House bill that's been put forward is Obamacare Light. It won't work. Premiums and prices will continue to spiral out of control. In fact, they acknowledge it in their own bill. But I think Obamacare Light doesn't fix it, and I think it's a real mistake to go for this. But the negotiation will be conservatives saying, hey, we're not going to take Obamacare Light.
Okay, so you're hearing some of this reaction today that they're Obamacare Light.
Well, I wanted to pick up on something Greg said because I think it's important. You said that at least they're having this debate.
Right.
So as Republicans, I can say, well, at least we're having this debate and not the other debate, because if Hillary Clinton would have won, then we would be debating whether or not to go to single payer right now, which is what the left really wanted. And so there will be Republican on Republican violence, and they'll have to try to work it out. But I do think that now that they have President Trump to be able to help them push it all together, he'll have to see how he can corral them. He might have to break a few kneecaps
It's
in
also,
a charming way.
Also,
In
you,
a charming
you have to
way, yeah, in a
understand,
nice
this
way.
is a historic first. I mean, you're having Republicans trying to create a government program. It's like a Democrat trying to say radical Islam.
Yeah.
No, it's
the
that the Republicans have become the custodians
Yes.
of an entitlement program that
Right.
President Obama put in place, and they're trying to do it in a way that doesn't cost as much money. Instead of, if they're going to make people mad, why not just make them really mad, right, and do all of it at once?
The strange thing is, Dana, we've been talking about this for 6 years. They've had 6 years to fix this. CBO hasn't scored this. We don't know how much it's going to cost. We don't know how many people are going to lose their insurance, as Greg points out, if there's more or if there's
But I
fewer.
thought nobody believes CBO anymore.
But okay, but here's the
Hold on.
point. Putting
Bob, I see your hand, Bob.
that competition across state lines in the bill wouldn't affect the cost of this to any individual at all. It wouldn't insure fewer people. It wouldn't cost the government any more money. So the only thing I can think of is there must be a deal at the other end of it somewhere. And
Maybe
what's the deal that we have to give up to get that?
First of all, I want everybody to know that Kimberly and I are still here. We're still on the show. I'll give you the political answer to the cross state lines. Eric's right. They use that over and over and over again. And for Democrats campaigning, it's a bad sales point. I mean, people say, what do you mean I can't buy it over there if I get it cheaper over there, right? So Democrats got tired of hearing it, and they ran the numbers. It didn't make that much difference.
Right, so they would say yes.
Yeah, they say yes. Well, that's free market. That's good. We're for it.
Well, that's good.
The problem is they're not going to be able to escape some of the criticism that we saw with Obamacare, because as it goes along, there still may be people that are going to lose their coverage, which is going to be problematic, especially when you have a system that is not sustainable financially to support itself. It's eventually going to cave in on itself.
You know what this feels like? And I was talking to Dana about this earlier. It feels like, remember when Nancy Pelosi said we have to pass the bill to find out what's in it?
Yep.
They're almost asking us to do the same thing. Trust us, phase 2 and phase 3 will be great.
Right.
So vote for this now. I would like to see phase 2 and phase 3. Look, call me crazy. But first of all, I don't think they're going to get it. I think the Freedom Caucus in the House is going to say no. That's enough to kill a bill. And there are at least 4 senators that would say no. That would kill a bill, too.
Well, then what does the president do?
Nothing.
I don't know.
All right.
Tweet. What you don't do
good
is
idea.
don't ever call it Trump care. Just never call it Trump care right
you
now.
just did.
It's always good.
I'm glad
perfect.
you said that.
The new